For optimal and consistent image quality, we recommend using a paralleling device. It will provide accuracy when using the Sopix 2 sensors and will also provide the correct distance between the object and X-ray source.
Okay, so the first thing we want to learn is to identify the pieces of the kit, right? So you'll have 3 bars, 4 holders, and 1 ring. The ring is designed to work with all the bars and all the holders. One of the sides of the ring is straight on the circle and one is offset. Straight is used for anterior and bite wings. Offset is used for the posterior shots. Anterior and bite wing, posterior shot, and it is labeled on here. I think you may not be able to see it, but bite wing and anterior. You see it there, labeled right there. Then to identify the bars, you'll have one bar that has multiple angles, 1 angle, 2 angles, that would be your anterior bar. You have another bar that has a right angle, that is your posterior bar. And then you have 1 bar that is just a straight bar, that is your bite wing bar. You have 2 bite wing holders in red, 1 anterior holder in blue, 1 posterior holder in yellow. Colors are pretty standard. Blue usually means anterior, yellow usually means posterior, red or green are usually bite wings. Okay, so we're going to start always with my anterior shots, which are the easiest shots to take. I will take my bar. I always position the bar away from me, looking towards the patient, and I will put then my sensor holder. This is the bottom part of the sensor holder. This is the top part of the sensor holder, so I want to make sure that it's facing up. So as I position my sensor, and one of the recommendations is not to slide the ring of the sensor because you may break the sheath. So always put one side and then clip on the next side. You can slide down a little bit just to make sure that the sensor is at the bottom piece right here, to the holder side. And I want to make sure then that I take the ring, right, the anterior and bite wing side of the ring, which is the straight side to the circle. I place it on my bar, right? I always like to grab my cable, twist. I always like to twist so there's not extra bag. And I always use a type of syringe type grip so I can hold the cable, the bar, and have very good stability on the bar. I always also gives me the opportunity by doing that to see that my sensor is always centered along the ring. So I want to make sure that my ring and my sensor are centered. Because I know now that if I put my 2 teeth here, they're going to be centered on this ring and my paralleling system will work for me, right? So that's my anterior. Take out the ring, take out the sensor. So all I have to do is just unclip one side of the sensor, undo this, undo that. Now we're going to move to my posterior shot. Again, the posterior ring and bar are, the bar is 1 right angle. It's the yellow ring, the yellow positioner, and the ring will be the one that is offset. So if it's offset, I know that the sensor in this one, it's easier to put the sensor first. Again, clip it on. So now I know that sensor is going down. So I got to make sure that this bar, if I hold it from here, see how the ring is higher? And now if I twist it, the ring is lower. This sensor is low. So I want to make sure that I have the ring going down. So up here, going down. If you look through, my sensor will be in the center. So on a posterior shot, this positioner right now will do 2 shots. It will do my lower left of the patient. I will flip over this and do my upper right of the patient. I will then take my sensor off briefly. I will switch over the holder, reposition my sensor, clip it on, and then I flip over my ring. Simple as that. Again, I verify that it's in the center, and then I will do my lower right and my upper left. Right. That is my posterior shots. Take out the ring, take out the sensor, then I take my bite wing, which is my straight bar, and I put my holder for a horizontal bite wing, right? Place my sensor on the bar, flip it on, make sure it's centered. I take my ring again, and I'm going to use it now again, the center one, because it's a simple shot. Just slide it on. I will now again verify that it's in the center, right? And this will do my right side of the patient. I will flip it over and do my left side of the patient.
Thank you, Alan. Now let's see it done on a patient. When taking a full mouth X-ray series, or FMX, we recommend always starting with the anterior shots first. These are the easiest to take. We then take the posterior X-rays, which are the most difficult, and end with the bite wing shots, which are again easy and a good way to end for the patient. When taking an anterior shot, it's a good idea to insert the X-ray on a slight angle, making it slightly smaller and easier for the patient to receive it into their mouth. Once you have it positioned, slide the X-ray ring down to the face as close as you can go. Place the X-ray. And take the image. You can then slightly move the X-ray or reinsert it for your side anterior shots. Have the patient bite down gently. Should it rock, reposition until stable. When it comes to the lower, you have two options. First, insert the X-ray on an angle, and you can position accordingly. The second option would be to have the patient use their tongue as a slight padding. This makes it a lot more comfortable for the patient. When taking a posterior shot, depending on the placement of the bite tab will be the direction used to place the aiming ring on the bar. Remember that the posterior section of the aiming ring is offset, and that is designed for it to follow the bite tab when placed up or down. Now that the sensor and aiming ring are set up, it will be ready to take two sets of X-rays, the lower right and the upper left. Then flipping over the paralleling device, it will be set up to take the lower left and upper right. Notice that the sensor is being inserted on an angle. This allows for the sensor to be more narrow and being placed in the patient's mouth. Once you have it positioned, ask the patient to bite down gently. Move the ring as close to the face as possible, line up the shot, and take it. Depending on your template, you can slide the X-ray forward or back to get full exposure of your posterior area. The same is going to be done by flipping the sensor 180 degrees, inserting on an angle, and now you're going to capture the inverse side. Your final shots will be your bite wing. These are the easiest and most comfortable for the patient. Remember, insert the X-ray on an angle so it is more narrow. Position, have your patient bite, and slide as close to the face as possible. You can simply make minor adjustments to this to capture the full bite wing. Flip 180 degrees, and you can capture the other side. Taking an X-ray, a full mouth series, is simply that easy.